Midwife versus OBGYN for perinatal care. What's the difference? What does that process look like when you are being seen and treated by two different types of professionals? My name is Jamila of Soul Child Essentials, and I am a full spectrum perinatal doula. What that means is that I support women through their full process of birth, postpartum, including pregnancy and infant loss, as well as fertility. As a holistic doula, I am a strong advocate for out-of-hospital births, and I felt like this was a great video topic to dive into to be able to help others make informed decisions on choosing a provider for your pregnancy and your birth process. Now, this question came to me directly from a friend. As my friends are considering expanding their families and just growing overall, more people are becoming interested in understanding the natural side of life. And I am so happy to be able to share this information with the community out here and to be able to help empower and inform you all so that you can make the right decisions for you to be able to have the ideal birth of your dreams. Now, as a doula and a mom myself, I have now gone through having a hospital-led OBGYN care labor for myself, as well as a holistic-based home birth for my last children. Now, the decision came after many years, lots of research and time of witnessing births, and I just felt more aligned with the natural side of what we were created to do and just living in that divinity of who we are and everything we were given. The tools we were given, we have it right with us. But when we are looking for having a baby, and it is a process that can weigh in and cause different challenges. So it is good to have someone that is around and available to assist you should anything happen and go wrong. So let's talk about the differences between those two types of care. So diving in, let's start with talking about the two by definition and trade of what they do. OBGYNs, also known as obstetrics and gynecologists, are medically trained doctors that have studied everything as it relates to the female anatomy and body. They are actually trained surgeons, meaning that they can do C-sections, episiotomies, hysterectomies, among many other things are in their scope of practice. When it comes down to having OBGYN care, we're going to also highlight the fact that they work alongside of other healthcare professionals such as nurses, anesthesiologists, and many more professionals that are found in these hospital-based settings that provide your overall full spectrum care from your pregnancy through your postpartum period. So when it comes down to midwives, we have 3 different types to choose from. And that might make a difference for you when it comes down to choosing a provider. Some of the things that'll make a difference are not only the types of midwives, but their availability and location base. Now, certified nursing midwives, CNMs, are nationally accredited nurses, but they have actual midwifery training so that they're able to help guide the process through pregnancy and labor as smooth as possible. They rely on their nursing training, which is either received before they come into midwifery school or as a result of them already being in midwifery school, they gain additional nursing skills. And these skills can include like suturing, administering IV and other vaccinations and things like that. Being nationally accredited allows certified nurse midwives to be able to show up and practice in many settings, including hospitals, birthing centers, and home births. Now, the other type of midwives that are available are a certified professional midwife. This midwife is a direct entry midwife. They do not gain any of the extra nursing background that the CNMs have, which makes them a little bit different. They have a blended form of care model where they take a lot of the more traditional sides and natural remedies of handling things, and they are able to just kind of bring that to the birthing process to be able to give the knowledge that's needed specifically for this process without all the extra interventions and things that might come about from other providers. Now, availability of CPMs might be a little bit different than the CNMs because these are not nationally accredited, and instead they are accredited based on their state. And currently we have about 30 states in the United States that are actually observing and recognize CPMs as professional midwives to be able to legally practice midwifery care. Now, last but certainly not least is the traditional midwifery model of care. With a traditional midwife, you are looking at someone who is not going to necessarily have a large certifying organization body behind them to back their skills and their knowledge. This type of professional would come with a lot more of hands-on skilled traditional knowledge that's typically passed on through their ancestors, from other granny midwives that give direct knowledge of things that have been done for generations and generations of time. Now, aligning with one and finding one can be very difficult, as there is a challenge out here for midwives overall to be able to be recognized for their professionality and not be booted out of spaces where they are providing health care for women to have babies. These traditional midwives will be the ones that are there acting and ready should anything happen where we're not able to access hospitals as much. And that these care models that have only been around for the last 100 or so years are not as readily available to everyone. And I know this may seem like something far away from time, but I always like to point it out. It is good. Be familiar with those in your community who do have certain skills of a traditional midwife, or just in general, having the birth knowledge and skills. These women will become very important in the years to come. Now, all of the midwives typically are going to be, again, more holistic based care, which means that they will be more readily available in out of hospital based births, be it a birthing center or a home birth. And based on which type of midwife they are will determine how much practice and availability they have. In my personal experience, I've found that midwives, certified nurse midwives that are associated with a practicing hospital, is more likely to fall in alignment with hospital policies rather than the personal autonomy of a woman and her family's choice of giving birth. Now, CPMs do have a blended care model where they do rely on some of the medical advances. They don't take away from it. They usually will have some type of partnership arranged with a hospital or other type of OBGYN in the case of any types of changes in transferring throughout pregnancy and prenatal care. Now that we've talked about different types of care providers for your perinatal process, let's talk about their different care philosophies and approaches that they tend to bring to the birthing space. Now, when it comes to OBGYNs, they tend to view pregnancy and birth from a more controlled lens view. They operate around standard tests and just controlled birth timelines overall. This process in general tends to interfere with the natural physiological process of developing the baby and birth, and the rigid hospital policies that they have to follow, typically because of legal purposes, really require them to kind of stick to certain things. And one thing I always like to point out to people is these are surgeons. If you're going to see a surgeon and expect no surgery, it's kind of backwards. Doesn't really make a lot of sense. Now, we don't minimize the work that OBGYNs do because they do bring valuable aspects of care models that are able to save lives of people who are considered high risk and needing those extra interventions along the way. On the other hand, midwives tend to lean more into flowing with the physiological birth process, honoring the natural flow of labor and birth. Midwives tend to be reserved for those low-risk pregnancies, and they may actually legally be required to transfer to a specialty specialist of like OBGYN care should certain challenges arise throughout your perinatal journey. This is going to be case by case, state by state as well, because every state has different laws about what is required and what a midwife is able to accept legally without allowing themselves to get into any type of challenges along the way. Their approach will be based a little bit different based on the CNM, CPM, and traditional midwifery as far as how they tend to show up and what they tend to bring. A traditional midwife may have a lot more knowledge on herbal trained practices and other natural remedies and things that just naturally engage the body to be able to heal and birth and move naturally. Whereas a certified nurse midwife is going to have a little bit more of that training where they're able to administer things such as Pitocin after birth to prevent hemorrhaging, or other aspects that may come along the lines with the testing that some women may actually prefer to receive throughout their pregnancies. I always like to note that what may be considered high risk to some may actually be considered a specialty to others. Many OBGYNs are not specialized in handling special complications such as breech births or twins birth naturally, whereas there are midwives who are actually trained on these things. They spend a lot more time dedicating to learning about them, and on occasions, you will find midwives that will still accept you with a breech baby. They may help you learn how to turn the baby around and do different things on that model, but they also just know how to manage it overall. And there are aspects of how they are able to keep mom and baby healthy after birth. They go through a wide range of training, such as neonatal resuscitation programs and overall birth emergency skills training, so that they can handle the most common birth emergencies that do happen and occur on average. Okay, so another difference that may be very valuable for you to consider when choosing a care provider for your pregnancy and postpartum care is about the time and continuity of care that each provider is able to provide for you. The amount of time the provider spends with you throughout your perinatal journey varies greatly from providers, and this may be something that weighs heavy on you in your decision-making process. Now, OBGYNs, I have found very commonly do not accept women into their practices before 8 to 12 week marks. Some of them literally wait till 12, 13 weeks because of the viability of the embryo overall. Most miscarriages happen within the first trimester or the first 13 weeks, with about 80% of the miscarriages happening in that time. If you are seeking out a provider that is in high demand, it is not an uncommon practice for them to make you wait until you've had that confirmed pregnancy test and your last period was about 12 weeks ago. For some, depending on where you are in your path, that may be okay and it may not be okay. For women who have concerns about their previous pregnancies and viability and things like that, you may need to find a different provider that's going to see you a little bit sooner. That might require a little bit more research to be able to get to that point of finding a provider who does prioritize your timeline and expectations of when you choose to be seen. But this is a general guideline and standard for OBGYNs. Midwives, on the other hand, they pretty much begin their care from the time that you sign them for that contract. So if you are ready to move forward and book your midwife early on in your process, as early as you want, many of them will be ready to welcome you with open arms and start trying to get you on the right routine and things that's going to help you have an overall successful pregnancy and birth process. When it comes down to prenatal visits, on average, OBGYNs spend around 15 minutes per meeting with their clients, whereas midwives will spend more so like an hour or more depending on the midwife and their services offered. Now, what else are you doing at the OBGYN clinic when you're not there for just the 15 minutes with the doctor? Typically, then you're going to be seen by like nurses and other assistants who are going to be sending you through various checks that don't really require the doctor to do them. Now, for some, this might be important and valuable if you're trying to build a relationship with someone. I think it's important to remember and note that those providers, like the nurses and those other staff, are not always the ones, typically, most of the time, they're not the ones that are actually there when it comes time to giving birth. Your OBGYN usually is a part of a practice with other OBGYNs, and when it comes down to giving birth and being there for their clients, they are on call on a set schedule, and it is not based on when their clients are due. So this means that you may end up going to the hospital to have your baby and ends up with a completely different doctor that you've not seen your whole pregnancy. I don't know about you, but that was exactly what happened with me my first pregnancy, and I didn't like it. It was not something that I was really happy about. And my doctor was cool and all, but it was just a lot of other sides to it, being introduced to someone completely new, all these new faces and things. And that plays a huge role in your laboring process too as well. I'll have to tap in on that on another video. So midwives, on the other hand, tend to have a lot smaller practices and limited availability for the number of clients that they will accept in a month's time. So they also have more of a continual plan for like the prenatal process as well as postpartum visits, where you are going to see them much more. That's one provider that you're seeing and spending usually about an hour with for each of your visits, and on a more consistent basis based on what their timelines and their practices standards are. They show up during active labor and they stay there through early postpartum, making sure that mom and baby are both stabilized. And it is very rare that a midwife that is contracted for you will have someone else show up in their place. I've really only seen it happen where a midwife needed to tag another midwife in if it came a case where they had two clients going into labor at the same time. And then in that case, you can't be two places at once. So then they do hire in and call in their extra backup support. Now, your midwife will let you know in advance if this is something that they expect to be needed or used, and you will be able to have the option of a lot of times to be able to meet that backup midwife as well, so that you can be a little bit familiar in the case that they do have to show up for you. Midwives also provide more postpartum visits on average. You can also look at your postpartum visit being done at the comfort of your home, which is a beautiful thing, to not have to get up and leave after you just had a baby a few days ago, and your provider just comes to you and allows your body to rest the way that it was intended to rest after giving birth and going through that whole process. So what a beautiful thing. And they tend to show up, they come, they may have one or two more visits in that postpartum period for you. Just depends on what your situation is like and what's going on. I've seen midwives show up and be there for their clients beyond what their contract stated because the woman needed them for different purposes. And that's a really valuable aspect of hiring a midwife. I have also seen that certified nurse midwives that work a part of a hospital body system do not carry themselves to the same level and standard of giving women that care and that continuity of care. I literally had a client that had a midwife in a hospital quit right after her birth, and she never even got to process her birth with that midwife. And I just couldn't believe it. I'm like, a midwife with their own practice outside of the hospital would have never done that to anyone. Never. That is not a thing. So these are aspects that are very, very important to consider for yourself when you're choosing a provider. And of course, many of you know that OBGYNs will typically see you throughout the days, throughout your hospital stay. After you've had a baby, you usually take the baby into a pediatrician afterwards within a few days to get looked at. And your final check for your whole birthing process with your OBGYN will happen about the 6-week mark. They stay pretty firm on that 6 weeks. And that's pretty much how it goes. So let's talk about our pain management options and those considerations, because of course, most people aren't thinking about going into birth and it just being a free-flowing process, pain-free. So when it comes down to your pain management options, of course, you're going to get the most wide variety available of pain management at the hospital. That's right, with the OBGYNs and their care team with anesthesiologists who are able to administer things like a epidural to you directly to give a whole localized pain, relief of pain below the belly, waist area and down to be able to move through the process of labor a little bit smoother. Those are not without their own complications and things. Always be informed and aware about what the alternatives are and what are the side effects of the different medications you can receive. Other medications that you may find available in the hospital can come through IV fluids, can also get laughing gas. I've even heard of midwives, actually, some of them, having connections to get the laughing gas. Now, this will probably be the certified nurse midwives that have that availability, but if that's something you're interested in, that might be something that you can ask questions about in your discovery phase and interviewing providers. In general, midwives will have a lot more techniques that they're able to provide for you to be able to help you with naturally managing the pain and the discomfort that you're feeling along the way. Now, I will always add to this because some midwives are not very hands on in the case of caring and providing for a woman in that way. So, if pain is something that is on your mind and you're a little concerned about, I would definitely seek out a doula that is going to be there. And that doula is there to, as much as possible, make sure you are comfortable through your birthing process to get you through the other side of seeing that baby. And even in the postpartum, they are there to show up for you and to do that extra level of work. So never minimize and never think that, oh, I have this provider over here, I don't need a doula or things like that. One thing about me as a doula, especially, and just a mom who has had many babies, I believe in the role of a doula very wholeheartedly. And I think that they are completely separated from everything and everyone else and what they do and what they're able to bring to the birthing family. And I think that you can never minimize that. So definitely consider that if pain especially is something that is on your mind and that you're wondering, how am I going to overcome this? What am I going to do? You can do it though. I just want to say we were all meant to do this. Our bodies were meant to go through this process, and anything that is stopping you from doing that, it's mind over matter. It's all in your head. Another important topic comparing OBGYNs to midwifery care is going to be the intervention rates. Now, this is going to look very different depending on the hospital, depending on the provider, depending on the midwife, of what their intervention rates are. But these are things that you can ask early on. Ask the provider, if you're looking at an OBGYN, how many of your people end in cesarean sections? What does the percentage look like for that? How many of your births are started by induction? That might be something that's really concerning and a good question to ask. On the other hand, if you're looking to ask a midwife some questions, you can ask them things like, how often do you have to transfer to a hospital? What are the types of things that will require you to transfer to a hospital? The more you are in that space of the hospital-based care, the more likely you're going to be introduced to a little bit more intervention. So if this is a concern for you, that might be something to think about when you're choosing a professional overall. And just learn to research, because research consistently shows that midwifery-led care is associated with lower overall interventions. And that's because they lean towards more of that natural physiological process and just letting the body do what it needs to do. So they will know all the tips and tricks to be able to help you through the birthing process without having to augment it too much. Now, if you are planning to have a hospital-based birth, I highly recommend grabbing my Language of Labor guide. I'm going to link it in the description below, but this guide is going to cover a wide range of terminologies, medical terminologies, procedures, and things that you may commonly hear throughout your pregnancy birthing process. These are great things to be mentally aware of so that you can actually use it to help guide your process, and it can also help you with developing the perfect birth plan. I also have a nice template that you can use and download for that birth plan. It's going to be linked in the comments as well. And if you would like some one-on-one guidance with creating that birth plan, I also offer 1-hour consultations that are fully educational based, and I will take you through and help you make the best decision for your family of what to include on that birth plan, and giving you little tips on how to advocate for yourself in those settings. So last but certainly not least, this topic comes up a lot as a huge concern for people when they're choosing a provider and making that decision, and that's the cost and insurance plan acceptance. So last but certainly not least, this tends to be one of the heaviest parts of choosing a provider that weighs on families, that really oftentimes dictates the whole process for them. And I really wish it didn't, but that's cost and insurance. It's a given. It's understandable. Money makes the world go round, and we got to do what we can to preserve it, use it, and do the best with it, using our resources wisely as possible. Now, on the traditional model of midwifery care, traditional being what we see now in the Western culture, is going to be OBGYN care at the hospital, and most insurances are going to be accepted at most hospitals. That's just the way it goes. Of course, there's going to be some small case by case where your plan or certain things may not cover exactly what you need from that provider. So you will need to ask these questions in advance. If you are planning your pregnancy, these are great things to be able to research ahead of time so that you are already covered and you already know before you have that baby, before you get pregnant, this is the office I can go to. They accept my plan and my coverage, or this one over here doesn't. Some providers are going to accept Medicaid, which is going to be the government provided low income based insurance plans, and their availability for accepting Medicaid patients may be on a limited case by case availability. So keep that in mind, and also know that there are options. There are sometimes options where you are able to get birthing center care from a midwife on your insurance. Now, that's going to vary widely based on your insurance coverage. I highly encourage you seeking out this information from your direct insurance providers in advance to ask them, what are your options? If you're interested in considering midwifery care, ask them what that looks like. Are they able to fully fund the process, or is this something that they could even reimburse for? Also, you can ask this question when it comes down to doulas, because some insurance companies do actually provide doula support. Sometimes you can choose your own doula. Sometimes they'll have their own directory that you have to choose from. And sometimes they'll pay directly. Sometimes you have to pay and then get reimbursed by providing a receipt. So these are all good things to consider and be ahead of, just to prepare yourself for that process. Now, if we are looking at, for real, speaking out of pocket costs, what you're looking at, midwifery by far is so much more affordable. It is going to provide you so many benefits to it. And a lot of choosing a midwife and paying for a midwife comes down to just the preparation of time. On average, you can find midwifery care being between $5,000 and $8,000. That's going to depend on where you are. Every state is different, and just the hearts of the midwives. I have watched midwives come down on their fees because they really want to serve and support families. They really want women to have these options for these low intervention births and to be able to fully feel into their power. And so sometimes just having a conversation and interviewing a midwife, you may find yourself being able to get on a payment plan and afford that care. Whereas if you go to the hospital, they're going to charge you to hold your baby. They're going to charge you for everything. A little saline pack of IV fluids when you could just be drinking coconut water and chilling. They're going to charge you a lot of money for what costs maybe a couple dollars in a bag. You might pay $50, $60, $70 plus dollars for it. So when we're looking at comparing the two, very greatly difference on price. A C-section alone is known to be valued at around $50,000. And I'm not even going to talk about what they do with our placentas and how they're making money off of that. That's a whole nother conversation for another day. But just keep this in mind, because the cost is subjective. The insurance coverage, they're scams anyways. Find out what you really need to have the birth of your dreams and make it happen. Know that it can happen beyond what money and things look like. I thank y'all so much for sitting here and listening to me talk about the differences between OBGYN and midwifery-led care for your perinatal process, and I hope that you were able to learn a lot from it today. I do want to add in a couple little special bonus information and just some things to consider that I didn't get to mention along these topic lines. I want to say that gestational age is not a predetermining factor for high risk or the fact that you need to have a hospital birth. This is going to look different for every woman, every provider, case by case, and what your previous history has been like. But I have seen women at gestational ages of 35 years plus have beautiful babies at home, have beautiful home births, having twins at home. These are things that are not always medical emergencies, and you can embody that in your mind, and you can find a provider and people who support you and get you to your goal for that as well. Also, previous pregnancies are not an end-all be-all indicator for future birth outcomes. So just because you had a cesarean section at the hospital does not mean you have to have another C-section at the hospital. I have seen beautiful vaginal births after cesareans, also known as VBACs, and I've seen HBACs, which are the home births after cesareans, which to me are just like, I just love hearing it so much from women that have gone through that process, that, they really empowered themselves and overcame their mind. They were able to align with a provider for midwifery care that was able to support and get them to that goal, because it's not impossible. Our bodies are not broken just because you have a C-section or you had a miscarriage previously. You are able to still see the goals through that you want to do and want to have for yourself. And I think that these are very important to keep in mind. Also, breech babies and twin births do not mean you got to automatically have a C-section. Shout out to my doula. She's a grand one. She had her twins at home, unassisted, by herself. She was her care provider. And if that ain't nothing inspiring to you, I don't know what would be. But just know that these are not the end all be all. And there are many midwives that are actually trained on these things. There are programs that train people on how to handle breech births of all different positionings. Now, that's not something that our OBGYN models are actually taking in, because that doesn't necessarily align with their care philosophy. But the midwifery care side, it does. So they can help you out a lot more if that is a concern for you, if you have a history of breech babies and things like that. And last but not least, everything is spiritual, and the energy and beliefs you hold surrounding your birth, your labor, it's going to overall impact your overall experience. So this is so important to me, for you to be able to hold your mind to a certain place of being, stay focused on the positive, and stay encouraged. Know that what you want is possible. It can happen. And work on that whole development of yourself. When we work on ourselves and we build ourselves up to be greater people, it impacts so much of our health and our outcome trajectory of our life. And I think that we sleep on that part of ourselves and just how valuable it is. So I hope that y'all were able to learn a lot from me today. Please leave your comments for me below. Let me know if this was a helpful video for you. If it was helpful, please give it a thumbs up and like it. Also, share it with someone. If you know someone that is expecting or they're planning to have a baby eventually, send this with them so that they can already be ahead of the game and already know what they need to be doing in advance. We don't have any time or any place, as people of color especially, to be playing around with these things. We need to be informed, we need to make confident decisions, and we need to just do it. We need to get through it, and we want to survive. This is our right, and we are meant to do that. And so I'm here again to empower and inform you. I hope that you all enjoyed this. Again, I'm Jamila with Soul Child Essentials, and I hope you have a great day. Peace.